Medical Stores is the government entity that is responsible for procurement, warehousing, and distribution of all essential medicines and medical supplies, all government health facilities in this town. And that includes the entire range of facilities, from those under the Ministry of Health, direct supervision, which are the national referral hospitals and the institutes. Then we have the regional referral hospitals. But we also have another range of health facilities that are under the supervision of the Ministry of Local Government and the local authorities, and those are the general hospitals, Health Center 4s, Health Center 3s, and Health Center 2s. But we also deliver medicines for all the facilities in the army, in the police, and in the prisons. So that is the entire stretch. Now, the medicines that we talk about include the medicines as we traditionally know them, but they are also medical supplies, which constitute the entire range of medicines and medical supplies that we deliver to all the government health facilities. And we've been doing this to the best of our ability for some time. We have come to realize from what we've been told by the patients, through you and through other channels, that Ugandans do not know, or some people have made them believe, that government does not deliver medicines to these health facilities. But we know that that is wrong. Government, through national medical stores, provides resources directly as appropriated by the Parliament of Uganda, but it also has medicines and other supplies that are provided to the government from the development partners. And all those constitute medicines and health supplies that NMS delivers to all the health facilities in Uganda. So for any Ugandan to even think that medicines are not delivered, when they every day see trucks, NMS trucks, which are clearly marked, delivering these medicines to the health facilities, is not only being economic with the truth for those that report as such that these medicines are not delivered or government doesn't provide them, but it also brings an angle which we are going to deal with today. And that is that some of these medicines may actually not be reaching the intended beneficiaries, who are the patients, and they are diverted to the private market. Or sometimes they even remain in these government health facilities, but the patients can only get them when they pay for them within the health facilities. So our call today is one, to inform Ugandans that these medicines are delivered regularly to all the government health facilities. Number two, to also inform you that NMS is not seated. We don't just sit in our head office or in the regional offices where we are placed and assume that the medicines that we send actually reach the people. We confirm that the medicines that we send from our warehouse actually reach the health facilities that are supposed to receive them. We have technologies that monitor these medicines from the time our trucks leave through GPS. We monitor them until they reach the intended destinations, which are those government health facilities. We have technologies that give information, alerts, to the people who are supposed to receive these medicines and who are also supposed to inform the other Ugandans that these medicines have been received through the SMS messages. And we also ensure that the critical people who are supposed to receive these messages actually receive them. So on the delivery schedule, we have a delivery schedule, and the NMS delivers once every 2 months. Once every 2 months, and that is what we call cycle. So when you look at our DMT and you see cycle, that is delivery for 2 months. That is why we have 6 cycles. So you will see cycle 1, 2, 3, 4, up to 6, because we deliver in the 12 months, we deliver 6 cycles because we deliver once every 2 months to the regional referral hospitals, up to lower in the health center too. But for Mulago, the national referral hospitals, we deliver to them once every month, because for them they do not have enough store to keep all the medicines that will be delivering to them, all the 2 months store. Mama kits, whether they are there or not, we have given you the information, and it is a fact. So go to the health facilities, ask them about the last delivery that we made to them. You will be able to see Mama Kit as one of the items that we deliver to those health facilities. So it is not just that we are saying, it is a fact that we deliver this Mama Kit. Why the mothers are not receiving them, that's why we are here. That's why we are here. Because I think, tell the mothers, lete chivera. So this is the Macintosh for the mother, so that when you are on that delivery bed, or when you are in your labor suit, they first put it there so that you do not make the other parts of the bed very dirty. This one is the cavera or the chivera for the baby, because sometimes, yes, when the baby comes out, you also need to put them in a different place. The same thing has gauze. They will ask you to buy this cotton wool and gauze, because the mothers need, most of the mothers in our places, in those lower facilities, use this one for padding. So they need the gauze to wrap around the cotton wool and use it for padding, so that if they have any fluids coming out of them, these padding, these fluids should be able to be absorbed. They always ask our mothers to get surgical gloves. Each Mama Kits has 5 pairs of surgical gloves. It is very rare that somebody, the person helping our mother to deliver, will need more than 5 pairs of gloves. In most cases, they need 3 or 4 pairs of surgical gloves. We also have this. This is when the mother comes, we should be able to bathe the mother, rather the kid, and keep them. This is it. This is the soap that you always find in this. We also have the razor blade and the umbilical tape, which is there to cut and make sure that we are able to tie the umbilical cord. So these are the basic things that are found in the Mama Kits. And these Mama Kits are available at the health facility. All government health facilities where mothers deliver, health center 3 and above. The challenge is, you are always telling the Wananchi that these Mama Kits are there. You are always telling them. You are the ones telling the Wananchi that the medicines are not there. No wonder the Wananchi believe that these medicines are not there, that these Mama Kits are not there. And that is the challenge that we have. So we believe that from today, you will give the correct message. That government provides the budget, and that budget procures and delivers these commodities to the government health facilities. Number 2, that the partners provide medicines and health supplies, and these ones are also delivered to health facilities in addition to what government has provided. That some of these supplies may not be enough, but we cannot know truly how much more we need if the tap is leaking. Let us first close the tap. Not even some. I think all these medicines, other than some of them that will be coming from government partners, will be embossed. They have clear distinguishing marks. Government of Uganda, not for sale. And you'll be able to see them. That red mark that you see diagonally is written on Government of Uganda, not for sale. From the factories where we deliver them. Whether they are tablets, as these antimalarials that you see, the Coatem, even the strip that you will get inside the pack is clearly labeled. If they are ARVs or any other tablets, they will also be clearly marked by that. If they are gloves, like you see here, they will also be clearly marked. I think you can open and the country should be able to see that these items that we deliver clearly distinguish from the others that you will ordinarily find in the government health facilities. So all these supplies are clear, and there should be no mistake as to whether these medicines, these supplies actually are supposed to be for the patients and are supposed to be received free of charge. So all the medicines, all the health supplies that we deliver to government health facilities are supposed to be given to the patients free of charge, at no cost at all. So for that Ugandan who has been paying for them, would request you that if you can help us, the partnership that we've been having, which we are also strengthening from today onwards, between ourselves, the Ministry of Health who are our supervisors, the health monitoring unit that supervises health delivery at all government health facilities, and the Uganda Police, whose role, primary mandate, it is to be able to detect this kind of criminality and ensure that they punish the offenders, is going to be strengthened. And that's why we are here. So again, I would like to appeal to you and through you to all the people of Uganda to guard jealously the medicines and health supplies that are received at all government health facilities in this country. To also appeal specifically to some, I will not say all because they are not all, some of those people that work at the health facilities. Some of them unfortunately may be health workers, but there are also other people who work within the precincts of government health facilities that are in the habit of getting these medicines out of the health facility through various forms. These medicines would live through the border borders that are stationed outside the health facilities, through the cars of the people who may pretend that they have come into those health facilities to receive attention. We have also heard of situations, not only heard, but seen medicines that have been smuggled or attempted to be smuggled out of the health facility through coffins. We have this, and we have the evidence through the health monitoring unit and other people. They have been able to arrest some of the culprits that have attempted to smuggle these medicines through coffins, pretending that they have a dead body, only to find that the medicine, that the coffin.
On behalf of the Uganda Police Force, I will re-echo a very strong statement in line with the enforcement against the theft or the security of medicines and drugs for the country. I would also need to remind you of what the previous presenters have mentioned, that the theft of government medicines, for us in security, we treat it as an infraction of national security. And that's why, should any matter arise involving the theft of medicines, we treat it with the seriousness it deserves. It is our wish as security forces to police a healthy population. So when you steal these drugs, you are undermining the health of the population. So this is something we cannot treat lightly. Then you also need to remember that our cardinal responsibility as enshrined in the Constitution is to protect life and property. So in this situation, life is lost when medicine is stolen, but when medicine is stolen, property is lost. So you realize that we have a duty on our back. Now, how do we treat these thieves? doctor has mentioned it. But these are some of the few things I would like to share with the general population out there. That we act on those primary persons within government who cause the theft or who initiate the theft. And we handle them under the Anti-Corruption Act. We also deal with those who are found in possession of suspected stolen property. One of the biggest challenges in this theft chain, there are those who think that there are usually accidents within the theft chain. Especially, let me give a scenario. We have had scenarios where somebody steals government medicines and then he keeps them at your residence. Now, when we are doing our investigations, we end up at your doorsteps. Now, in our experience as law enforcement officers, we have come into contact with such persons pleading for their lives. Police, help me. This man, I didn't know he was a thief. He brought medicine and stored it and told me to keep it. So, make use of this communication I am making today. That Mr. Kamabale has made life very easy for all of us Ugandans. He embosses the medicine. The challenge would be if the medicine has no embossment, has no mark, but he has made life very easy. Even a juvenile can tell that this is stolen medicine, because you simply need to read, not for sale, government of Uganda. And in this world where there is free education, there will be very little defense that you could fail to differentiate and discern that this is stolen property. Even transporting, you will be an accomplice to that offense. In other words, the chain can mean to harvest very many actors. So what we are saying, do not participate in the theft. You leave the other man die in his own movie. So, that is a very important message. As a police officer, I would wish to push forward.
Kati okulikabalinga sente ezo kiba kizibu, naye kanbaweerezeko ekimu. 2021, fiscal year 2021, we recovered 6.2 billion shillings worth of drugs. Obuwumbi 6 bw'eddagala. Mu mwaka gwa 21-22, we recovered 2 billion worth of drugs. Obuwumbi 2. 2022-23, we recovered 1.2 billion worth of drugs. 23-24, we recovered about 800 million worth of drugs. Tubatwala mu kooti ne babeerayo ne banoonya lawyer, oba akatuukaawo lawyer ne bagamba nti lawyer timulwadde postponement. Ne muddayo ne bamuleeta n'agamba nti kati lawyer ono sikyamwagala njagala omulala. Ne baleeta ne postponement. Waliwo gwe twakakwata emirundi egyo 3 naye ng'atutwala mu kamungulize bwe kati. Waliwo bwe twakakwata Embaale nabo batutwala mu kamungulize bwe kati. Western region, same thing. I have the figures here, I can give them to you. But the biggest problem is that ababbi tosobola kuba bw'obanga tolina magezi, babeera n'amagezi mangi ate tebabba bokka. There is what we call syndicated corruption. Abeno n'aba n'oli n'agenda anoonya lawyer omututu oli ow'omutawaana ne batambula bombi nga bwebabonyabonya gavumenti ne tuddayo komawo oddayo. I have suffered a lot. I can tell you about that. tosobola kulijja mu store kati ani alijjamu. That's a very, very important question she's asking. And a thief from outside cannot steal drugs without collaborating with somebody in the hospital. And I am telling you, I am a physician. I am a physician. Some of us are thieves. We have nurses. Some of them are thieves. We have pharmacists. Some of them are thieves. Those, Susan, those are the ones who give you the drugs they steal. You go sell, give them a bit.
Any one of you, if you have your smartphone, you just go to Google, put in dmt.nms, dmt.nms. Are you there? Yeah. Just Google. This is available for every Ugandan. dmt.nms. Are we there? I don't know whether we are together. dmt.nms. And there you should be able to see NMS dispatches. You should be able to see the NMS deliveries. You should be able to see LMD deliveries. Those are last mile deliveries. That means that the delivery to the individual health facility. When you click at DMS, you will see something like this. Are you there?
Are we there?
Are we there?
Yeah, we're watching.
Yes. So once you are there, you'll be able to see dispatches from NMS. That is the medicines that we have sent. You will be able to see NMS deliveries. That is when we deliver at the DHO's office. Then you will be able to see LMD deliveries. That is when we pick them from where we have delivered them at the DHO's office and we deliver them to the individual facilities. So if you click, for example, on LMD deliveries, just tap on NMS deliveries and you go down. You will be able to see where we delivered on 27th. That was the last delivery that we made to the individual health facility. 27th of this month, the district was Moroto, and you will be able to see the individual health facilities that we delivered to. And you can also go across and see the in charge of the facility who received this message. And if you continue across, you'll see that this message was copied to the DHO of Moroto district, the RDC, the CAO, the MPs, and the in charges. If it is ongoing, we should also be able to indicate that. And the same thing, if you want to know where we have delivered this morning or which vehicles we dispatched this morning, you can also click and get to know. So this is something the Wananchi can make use of, to know that the medicines have been delivered and to go and ask, because you are free to go and ask more details from the people who will have received these medicines.
Issues of theft of drugs definitely is a fundamental concern for Minister of Health, because as all of you know, health is wealth. So if there's any interruption on the supply and availability and access of medicines and medicine supplies, definitely it affects, it has got impact on the health service delivery, which definitely will have a bigger impact on the wealth of the country. The Minister of Health has sought to improve medicine's accountability and prevent medicine theft, improve monitoring of clinicians' outputs, but also improve on patient management. When we speak about theft, definitely it takes a number of forms. And I think the most forms which we know is normally when you do with bulk theft of what? Drugs. But also what remains significant is what we call pilferage. It's where you keep removing small bits and small bits, and ultimately, if you add those small bits, it becomes a very big amount, which definitely has impact. And when it comes aspect of service delivery, when you come in, it means that by the time the patient comes in, either as a mother to deliver, it means that the glove should be there. If it doesn't, then it causes what we call a third delay. First, it probably has delayed from home, which has delayed to access transport, but also when it gets to the facility, again there's a delay because first of all there are no gloves. So we really, as a ministry, we want to thank this multi-sectoral approach where different government entities are coming together to address this, because the main person who is affected definitely is the health sector and me as a service provider. So to achieve this, the minister has rolled out the electronic medical record system in facilities as a digital tool for management of medicines and medical commodities. Currently, most of our facilities are able to order drugs from NMS electronically. So that has been addressed. But now what we need to address is the aspect of last mile, that how does it move from the store to the individual, and how do we account for it. So this system has been able to help us to promote this. We are on the early phase. So far we have rolled it over to 77 health facilities that are currently. And we started at the high volumes, all the national hospitals, the regional referral hospitals, 54 general hospitals, and also in a few health center force. So we seek that this will digitalize the whole medicine management ecosystems. And if this is done, I would implore you, since you are within Kampala, you can visit the hospitals in Kampala, you can visit Kirudu and visit others, and you'll be able to see that you cannot access drugs if your information has not been entered into the systems. The other aspect which we think definitely also will be able to cap this is the new national Drug and Health Products Authority Bill, which is being discussed, because it has come with very strict penalties. So when this law puts into place, definitely the penalties, and as the Apande has highlighted, definitely there will be a special code for those who steal government drugs. So whereas we are waiting for that, I also want to take the opportunity to just indicate that medicine is not a solution for everything, and I think that here is prevention is better than cure. So that the demand of medicine does not continue. So we need still to be able to implore. So there are many mechanisms which we can be able to do that. And I will want probably the members of the first estate, yourself, to start with that. How do you care for yourself? What we call self-care. And when you do that, then probably the need for drugs will not be what? Will not be significant. Why should you drive in a high speed and then get an accident, and then you say that you should get into a health facility and become an emergency?